Young Lives is a collaborative study of the Millennium generation. Its design and scale is unique, following the same 12,000 children growing up in 4 countries to identify what can be done to lift children out of poverty. The poorest children experience intersecting disadvantages, including their rural location, ethnicity, and household poverty. Their first years of life are critical. Weak basic services, food insecurity, and household poverty all undermine healthy development, and low maternal education and well-being also matter. Undernourished children arrive at school the least prepared and able to learn, and the poorest have the least access to early learning programs, despite standing to gain the most. Investments in quality and equitable preschool systems pay off for both children and society. Early childhood is foundational, but it's not the only life phase that matters. Some children whose growth was stunted in early life show normal growth later, linked with improved learning. The poorest children generally experience the weakest schooling and face the greatest pressure to juggle education with work. Important measures include making schools safer, prioritizing quality schooling, irrespective of a child's gender or background, and helping relieve competing demands so children can meet their hopes for education. Adolescence is a second window of opportunity, but also a time of great responsibility and risk. Children's economic contributions accelerate during adolescence, even while they strive to remain in school. Gender disparities grow as young people and their families start making choices around intimate relationships, parenthood, and work. To continue to transform lives, access to training, livelihoods, and decent jobs is essential. Young people must be at the heart of inclusive policies to create healthier, more productive, and just societies, and to break the intergenerational transmission of poverty. We're excited to see where they go next.
Thank you for this opportunity and for your support. You just heard about what the Young Life Project is. In Peru, it's a collaboration between GRADE, IIN, and the University of Oxford. We started collecting data in 2002, and we started in 20 districts. But because of migration, by now we have to visit more than 300 districts across the country, in urban and rural areas in the 3 climatic regions. Last year, everything changed. The COVID-19 crisis hit us very hard. We have the highest mortality rate because of COVID in the Latin American region. And also, because of the lockdown and because of the limitation in economic activities, the GDP fell by 12%. Because of this situation, we decided to run a phone survey in the 4 countries in which we ran the Young Lives study. This phone survey took place between June and December. Let me tell you about some of our key findings. In the younger cohort, which are aged between 18 and 19 years old, 2 out of 10 participants drop out from education, mainly because they were unable to pay the fees, but also because some of them didn't have the means to access remote education. It's not clear if they're actually going to go back to education. Also, in the older cohort, which are aged 26 years old, we found that 4 out of 10 lost their jobs during the lockdown. There has been some recovery since then, but not complete. We also found that self-employment increased during that period, which suggests that the quality of jobs has decreased. Very few, less than 10% of the sample, are able to work from home. In addition, we found that 2 out of 10 Young Life families suffered from food insecurity during the last year. Although many of them received cash transfer from the government, these transfers arrived late and were insufficient for them. We also found that 4 out of 10 of our participants reported signs of depression and 3 out of 10 signs of anxiety. These are very high levels compared to a normal state. Even though there's been some recovery now, the rates remain very high and are a concern from a policy perspective.
On 2020, we gathered qualitative information related with COVID and higher education. We contacted the qualitative younger cohort sample to explore different issues around the impact of COVID on their educational trajectories and aspirations that were coming out of the phone survey. We did 21 phone interviews with boys and girls from rural and urban areas between October and November the last year. We gathered information about different challenges of virtual education from young people who live in poverty. We explored also how COVID affects women and men differently and how the pandemic restraints affect their family situations and their future lives. A follow-up qualitative study could return to the full qual sample followed since 2007 to address the core themes of the wider study, including education, labor market, pregnancy, and family relations. Despite the pandemic, we remain very active the last few months. In July, we have our first webinar to present findings about the impact of violence on women's life. In December, we had another webinar in which we presented the findings of the phone survey with the participation of the Ministry of Education and the International Labour Organization. In March, as a part of our building capacity activities, we completed our first virtual methods workshop with students from Lima and other regions, including ODF grantees. And all along, we have been producing policy briefs with a summary of our findings. We are also working closely with international organizations to measure the implication of COVID-19 for the youth people. With the International Labour Organization to analyze the effect of pandemic job loss and the workers' resilience. With FAO to collaborate on the analysis of youth insecurity data, and with JPAL at FCDO to report our findings about the impact of violence during COVID-19 in Peru and India. Our findings have been published on important newspapers, including El Comercio, the main newspaper in Peru, The Guardian in the UK, La Presse, the main newspaper in Canada, and we also have had interviews on TV and other newspapers in Peru with the objective of maximizing the dissemination of our findings.
We've also been working towards publishing our research in top journals because that increases the policy impact of our study. Last year, we published one study in a special issue at the Review of Development Economics journal about the risk factors associated to teenage fertility in Peru, and also another study about the impact of domestic violence during the early childhood on child development in subsequent years. Although we just collected the phone survey, we are about to publish some studies, two in medical journals about the impact of the crisis on mental health, one in a development journal about the impact of the crisis on education and well-being, and another study with our results about the impact on food insecurity at a public health journal.
All of us in the team are really delighted by the support that we have had from the ODART Foundation for our program and are really excited about the prospect of continuing the partnership moving forward. Our proposal has got three components to it: data collection, research based on the data, and the all-important one of input into the policy process. In terms of our data collection, there are both quantitative and qualitative components to this. Last year we had a very successful experience of conducting 3 phone surveys with the respondents in the Young Lives sample, focusing on the impact of COVID on many different outcomes. In addition to this, we did some qualitative work which provided a lot of very important additional insights about many other issues, including people's resilience to the shock. In the coming year, we plan to rerun another phone survey and another qualitative investigation. Now coming to research, of course, the purpose of the data collection is to help inform research on really key questions which are going to inform policy. Our interest here is particularly in questions about education, work, well-being, including mental health, and family issues, including domestic violence. To add to that, we're very interested in the question of resilience. All of this is, for the next year at least, is going to be focused on the impact of the pandemic on these different outcomes. The purpose of this data collection research is to input into and inform policy, both international and within Peru. Within Peru, we have a strong track record of working with key policy actors in government, in NGO and other areas, and also working alongside other ODF grantees. And this is something we very much will continue, particularly thinking about the responses to the adverse impacts of the pandemic. We're very grateful again for the support of Old Art Foundation and for the close relationship we have. The Peru team, the University of Oxford, FCDO, we all very much appreciate this and look forward to continuing our relationship moving forward. Thank you.